That's me on my second birthday. That's me on my first day of school. And again at age 11. And here I am, at 28. This is to illustrate that Canada needs cradle-to-grave care. It's the concept that social systems should care about people from birth to death, from cradle to grave. I have cerebral palsy. I was one of the first kids in the UK to be given Botox to counteract spasticity. I had the opportunity to be educated in a specialized British school with access to physiotherapy. My parents chose to keep me in the regular school system instead, but they were provided with supports and equipment for my disability, like a standing frame. When I turned 18, and was by then living in Canada, those low-cost supports turned into out-of-pocket expenses. If I wanted a wheelchair that fit me well, my parents would have to pay for it. What the system fails to understand is that my brain damage didn't magically disappear when I became an adult. Government supports for people with disabilities tend to be skewed towards children and those who are institutionalized. The rest, a mushy middle. But that middle is a lot of people. 1 in 5 Canadians have a disability. The difference in care, depending on age, starts as early as adolescence. For example, the Saskatchewan government increased funding for autistic children in 2021, but only up to those age 11. For many, our care system tends to maintain the status quo, if that. It's a care system that's underfunded and relies heavily on the charity model.
$3,850,254, and where are we going? Higher!
When I graduated from high school, I found out that the only way to get a wheelchair that fit me properly, without using a loan program or the bank of mom and dad, was to apply to a telethon. If navigating the bureaucracy of disability support is like trying to stay afloat on a small raft, then aging out of the youth system is a bit like finding yourself in a different ocean entirely. Our care systems are precarious and can be ripped out from under us. Take the Saskatchewan Assured Income for Disability program, for example. Moving cities can mean a decrease in funding. How far that money stretches is also at the whim of the economy, as the program was never indexed to inflation. Every year, disabled advocates ask for money to make up the shortfall, and every year, they are ignored. Disabled adults are, broadly speaking, expected to struggle. If I died as a child, my life would have been a tragedy. If I die as a senior, I've lived a long life. If I die now, I'm just a data point. But it doesn't have to be that way. We need to better design and fund our social systems around the idea that disabled children turn into disabled adults. We need to increase support for social programs. We need to cover therapies regularly. We need people not to be reliant on crowdfunding for medical devices. Let's strive towards those with disabilities thriving, rather than just surviving. Till death do us part should not just be a slogan for the altar, but reverberate in the minds of all when it comes to disability supports.